Welcome to the deep dive. We've just gone through quite a stack of sources covering healthcare quality, patient safety, formal accreditation, and also the really human part of it, all those relationships between patients and providers.
That's right. And you can sort of think of this as your guide, maybe, to understanding how excellence gets built into healthcare systems, both globally and, nationally.
And how you fit in.
Exactly. And how you as a patient can navigate and really strengthen those personal connections, which are just, well, they're critical for getting the best care.
Okay, so our mission today is really to pull out the essential insights from all this material. What accreditation like JCI and NABH actually means on the ground, and the practical ways you can build trust, communicate better, and really partner with your healthcare team.
Yeah, there were some quite surprising bits in there and definitely some actionable strategies for you.
All right, let's dive in.
Okay, so let's start with that foundation, the big picture stuff that supports quality around the world. Our sources really point to Joint Commission International, JCI.
JCI, right. They set standards, they accredit healthcare organizations, I think the sources said in over 70 countries.
That's it. And we're talking over 1,000 programs accredited or certified. It's not just, handing out participation trophies.
No, definitely not. These JCI standards are described as really rigorous. They're designed to push organizations towards, well, the highest levels of safety and quality they can achieve.
And a really concrete example of their work that the sources highlight is the International Patient Safety Goals.
Ah, yes, the IPSGs.
Exactly. These focus very specifically on areas where patient harm has historically been, a significant risk globally.
And what's useful is how practical they seem, like tackling medication safety, making sure the right patient gets the right drug, right dose, right time.
Sounds simple on the surface, doesn't it? But the sources show just how complex and absolutely critical it is to get that right consistently across all sorts of different healthcare settings.
It really speaks to their mission statement, which I think was something like, to enable and affirm the highest standards for all.
Of healthcare quality and patient safety for all.
Yeah,
that captures that big global aim.
And, okay, JCI is international, but the sources also mention national bodies doing similar work, like in India.
Right. There's the National Accreditation Board for Hospitals and Healthcare Providers, NABH. They set the quality benchmarks specifically within India, and they're part of the Quality Council of India. Similar goal, national focus.
So this brings up a really important question, I think. For a hospital or clinic, why go through this? Accreditation sounds intense, expensive, takes a lot of time.
It really does. What's the payoff? That's what you're asking.
Yeah.
Well, looking across the sources, especially some of the testimonials from organizations that have gone through it, it's clearly much more than just getting a nice certificate for the wall.
I remember reading one administrator described their JCI journey almost like this huge forced team building exercise.
Yeah.
Said it massively boosted coordination, communication across departments. Like it broke down silos.
Yeah, exactly. Got everyone on the same page about protocols, about safety procedures, really standardized things in a good way.
Another angle was the external benefit boosting community confidence, maybe even a competitive edge.
Sure, that's there too. But internally, the sources really stress how much it improves risk management, reducing errors, which of course circles right back to patient safety.
So it formalizes things, makes safety part of the culture, not just an add-on.
Precisely. It helps cultivate that culture where patient safety is really front and center, not an afterthought.
Okay, so you've got these big systems, these standards, pushing organizations to be better. That's the framework.
The structure.
But as the sources really drive home, all that structure still comes down to the interaction between one patient and one provider, that really personal connection.
Absolutely. This is where the system quality has to translate into the individual experience. And the sources are super clear on this. Building strong, lasting relationships isn't just, a nice to have.
It's foundational.
Foundational. Yeah, for quality care. When that relationship is solid, you generally see better health outcomes, fewer mistakes, and care that actually feels personalized.
Okay, let's really try to unpack what builds these connections based on what we read. Trust seems to be the absolute core.
It's presented as totally non-negotiable. As a patient, you have to feel safe enough to be vulnerable, right? To share everything honestly.
And how do providers build that? The sources mention competence, obviously.
You need to feel you're in capable hands, yeah.
Yeah.
But also authenticity, being genuine.
And on the patient's side, for you listening, It's about being open and honest about your health, your history, symptoms, maybe even lifestyle things you're not proud of.
Yeah, holding back details, even small ones, can really get in the way of effective care. It hinders diagnosis, treatment planning, everything.
Communication, that's the other big pillar, right? Described as critical.
Absolutely critical. And for providers, this means more than just talking. It means active listening, like really hearing the concerns underneath the words.
Using clear language.
Yes. Ditching the medical jargon, showing empathy, compassion, and importantly, involving you, the patient, in the decisions. That whole idea of shared decision-making.
And for you, the patient, what does effective communication look like from your side?
Well, asking questions persistently until you're totally clear. Don't just nod if you don't get it.
Use the tools, maybe, like patient portals.
Definitely. Use those portals or apps for non-urgent questions, updates between visits, and bringing someone with you, a family member, a friend, that can be so valuable.
Yeah, a second pair of ears.
Exactly. They can listen, ask things you forget, help you process it all later.
The sources also talked about shared goals and expectations. That seems important too.
Very. It's not just the provider telling you what's going to happen. Good care planning is collaborative.
So the provider needs to be realistic about what treatment can do. Manage expectations.
Manage expectations, yes. And you need to be part of defining what your health goals actually are. What matters most to you.
And then follow-up becomes about tracking progress towards those goals together.
Right. It makes follow-up meaningful. And this whole process is not a one-off. It's ongoing relationship building. Needs nurturing.
How do providers nurture it? The sources mention things like asking for feedback.
Actively seeking out and responding to patient feedback, yeah. And staying current, obviously, through continuing education. That builds confidence, too.
And for you, the patient, how can you nurture it?
Expressing appreciation is simple but powerful. A thank you can really strengthen rapport. And giving constructive feedback when something isn't working.
It was interesting that some systems are formalizing this now with something called patient relationship management.
PRM.
PRM. Yeah, PRM. It's basically a structured approach providers are starting to use specifically to maintain these relationships over time. Puts patient-centered care and continuity right at the forefront.
It really shows how much organizations are realizing these personal connections matter, doesn't it? It's not just about the clinical stuff anymore.
It underscores that while care happens in a system, the experience of care is deeply personal, and both sides play a part in making that experience work. Okay, so let's shift gears and make this super practical for you listening. Based on all this, what are the actionable do's the sources suggest for patients and families?
First off, be intentional when you're choosing a provider. Don't just pick a name off a list if you can help it. Look for someone who seems to genuinely listen and communicates clearly.
Pay attention to their style, how they explain things.
Exactly. Do they seem culturally competent? Some sources even suggest trying a brief meet and greet first, if that's even possible in your system, just to get a feel for them.
And then, once you're in that relationship, be honest. Don't minimize symptoms or hold back information because you're embarrassed.
Yeah, that came up again and again. Withholding details, even stuff that seems minor to you, can really impact your care. Be open.
Respect their expertise, obviously, but don't be afraid to ask for clarification.
Never. Your understanding is paramount. It's your health.
And try to stick with a consistent care team if you can.
Continuity is key. Seeing the same people over time lets them really get to know you, your history, your baseline. Makes it easier to spot subtle changes early.
Maintain those follow-ups, even if you're feeling fine.
Crucial for ongoing management and catching things early. Don't skip them.
And again, express appreciation, acknowledge good care, but also be willing to give constructive feedback if needed. It helps them improve.
Definitely. And the forces had some really good tips specifically for your side of the communication piece, like keeping a health diary.
Yeah, tracking symptoms, writing down questions before the appointment so you don't forget in the moment.
And use those patient portals if you have access. Great for non-urgent things, follow-up questions.
There was also that idea of medical storytelling. What was that about?
It's not about being dramatic. It's about being clear and organized when you describe what's going on. Using the 5 W's was the suggestion.
Who, what, when, where, why now?
Exactly. Who noticed it? What does it feel like? Sharp, dull, constant? When did it start? How has it changed? Where is it? And why? Now, what's different recently? And definitely don't downplay your symptoms.
The whole point seems to be shifting from being a passive patient to an active partner.
A prepared partner, yeah. Before you go in, list your top 3 concerns. Focus the visit. Bring your med lists, any relevant test results, insurance stuff.
And during the visit, repeat instructions back. Okay, so you want me to take this twice a day?
Perfect. Confirms understanding.
Yes.
And always ask that question. What's the next step if this doesn't work? Shows you're thinking ahead, engaged.
You mentioned continuity earlier, that benefit of them seeing trends over time, that longitudinal view.
It's incredibly powerful. Helps catch things that might be missed in a one-off visit.
Yeah.
And if you do have to switch providers for some reason,
Get those records.
absolutely essential. Get them shared electronically or request hard copies. That history needs to follow you for your new team.
Which kind of brings us back full circle, doesn't it? How the system level, the accreditation, and the personal level, the relationship connect.
They really intertwine. When organizations commit to those rigorous standards, they create the environment where strong, trusting relationships are more likely to thrive.
So good systems support things like clear communication protocols, better coordination between specialists.
A culture that actually values patient input. All that helps build the foundation for good relationships.
And then strong patient-provider relationships
Yeah.
built on that trust and communication.
They feed back into the system's goals. Better communication reduces errors. Trust improves adherence to treatment plans. It becomes this positive cycle.
You even see companies like Supramatic mentioned in the sources working on this from the business side, helping facilities meet NABH standards, building quality into operations.
It just shows it's becoming part of the infrastructure planning now.
Okay, but what if, despite your best efforts, the relationship just isn't working? The sources did mention some warning signs.
Yeah, things to look out for, like if you consistently find it hard to get your questions answered properly, if you always feel rushed or dismissed.
Or maybe weird billing issues, communication gaps from the office staff that never get resolved.
That too. Or a clear lack of coordination between your different doctors, especially if it's supposed to be in the same system. That's a red flag.
So if you see those signs, what's the advice?
First step the sources suggest is try talking about it directly with the provider, if possible. Express your concerns openly and see if things can improve.
And if that doesn't work, or isn't possible,
Consider getting a second opinion. It gives you another perspective on your health situation and the proposed care plan.
but if the core problems persist, like you're repeatedly dismissed, care stays poorly coordinated, you just don't feel respected.
And then the sources say it might be necessary to think about switching providers. It's a big step, but sometimes it's the right one for your health.
And the crucial thing, if you switch,
Direct records transferred, or get copies yourself before you leave. Cannot stress that enough.
right, that preserves the continuity of your information, even if the personal relationship changes. Vital.
So, wrapping this all up, this deep dive really shows that healthcare quality isn't just one single thing. It's this blend.
It's the big picture commitment to standards and accreditation like JCI, NABH, building that essential framework for safety, for efficiency.
And it's combined with that absolutely vital personal partnership you build with your own providers, grounded in trust, clear communication.
Yeah, and shared goals for your health.
And building those relationships, yeah, it takes effort from both sides. But the payoff, better outcomes, feeling more comfortable, feeling like a real partner in your care, it's just immense.
It really puts you back in the driver's seat, in a way. Makes you a key player in your own health journey.
Definitely. So given how absolutely critical trust and communication are in that partnership, here's maybe a final thought for you to sit with. Knowing all this now, how might you approach your very next healthcare interaction differently? Thinking of it not just as another appointment, but as a chance to strengthen a really vital relationship.